Kia ora everyone, welcome to your first flip class for 2017. A great one to start off with in terms of what we're talking about in terms of positive sexuality. We're looking at contraception. So hopefully you got your whisk sheets ready to jot down some points and some sentences about some of the content that we'll be talking about in the PowerPoint. It is going to be information overload, so I've tried to knock off a few of the PowerPoints that won't be needed, but there will be some things that you'll still need to research yourself. Some of the contraception information in the pink book will not be covered in this PowerPoint, so it's up to you to go search some of those things. Now, in terms of contraception, a lot of you might be asking, what is it all about? So basically, contraception is basically just a way to prevent pregnancy. Although different methods work in different ways, contraception generally prevents sperm from reaching a fertilized egg, which is how pregnancy starts. There are different forms of contraception. Some are more effective than others. And the best people to talk to when these types of things arise is your doctor or nurse, who can help you about the best kind of contraception that you could possibly choose. Right? It is, more risky for girls in general. The risk problems for pregnancy. Contraception allows them to put off having children until your bodies are fully able to support pregnancy. It can also prevent pregnancy for older women who face pregnancy-related risks. But there is only one contraception that may protect you from STIs, and what is it? Yeah, it's condoms. Yeah, so the condoms are the only ones that protect you from STIs. Other contraceptive methods are things like abstinence, like actually not having sex as well. All right, so I've taken a few of the slides out of here because the PowerPoint would be too long, the video would be way too long. So I've taken out fertility awareness, the emergency contraceptive pill, which is the morning after pill, tubal ligation and vasectomy. Now, tubal ligation and vasectomy have to do with basically like tubal ligation is when the women have their fallopian tubes clipped, and so the eggs can't enter the uterus anymore. And vasectomies are all about like a permanent method for the boys where their tubes, their vas deferens, which carries the sperm, are cut and tied, right? And they can't come back from this. The sperm stops getting to the penis, right? So those are some things that are missing. If you want to know more information, then you'll need to research it in your time, right? So the contraceptive pill, very common, and it's a thing that women take, quite often in terms of preventing pregnancy. What is it? It's a pill, and you take it orally, and it's a combined pill that contains hormones such as estrogen and progesterone, which we watched on that video in the computer lab. So how it works is it's taken orally, yeah, but it does stop the eggs from developing, so there is no egg released from the ovary. It works very well in terms of preventing pregnancy, which has a 99% effectiveness rate. There are advantages and disadvantages. The advantages are that it's 99% effective. It's convenient and simple to take and doesn't interfere with sexual intercourse. Some pills can also improve acne. What are the disadvantages? So the obvious one is you must remember to take it, and the other one, it must be taken every day, whether you have sexual intercourse on that day or not. So you must take it every day. It's on the cycle. The next one is the Depo-Provera. So it's commonly known as it's the jab, yeah, and it's a contraceptive injection containing progesterone again, and the injection is taken every 12 weeks, right? It prevents pregnancy by stopping the ovaries releasing an egg each month. Also, there are changes to the lining of the womb. how it works is it's almost 100% effective, and if you have your injections on time, yeah, so every 12 weeks. The advantages and disadvantages again is that the DP is 100% effective. It's convenient as it lasts up to 12 weeks, so there's no daily pill taking, so it is what it is. It often helps women who have heavy or painful periods as well. The disadvantages are, well, once you've had the injection, the contraceptive effects, they almost last up to 12 weeks, but there's other effects that may last for short times or even longer, yeah. The next one is the IUD. IUD, a lot of people, some of you might have seen these, some of you might not have, in terms of other health lessons that you've been in. So the IUD is the intrauterine device. It is a small device that fits inside the womb. You can't feel it or tell it's there, but it is there, yeah. There are two types of IUDs. There is a copper IUD, and the other one has progesterone hormone, which is slowly released into the womb. Right, so how do they work? The main way an IUD works is preventing fertilization of an egg. Yeah, and the copper or the hormone from the IUD stops the sperm moving through the womb towards the egg. Now, occasionally an egg is fertilized, so the IUD then stops the egg settling and planting into the womb, yeah, and fertilizing. So it's almost 99% effective again in preventing pregnancy. The advantages is it's long acting and very effective. Can stay in place for 4 to 5 years or more, and can be easily removed once you want to have a child. The disadvantages are that it can lead to a heavier flow. Now the diaphragm. We've talked about the diaphragm a couple of times. Now the diaphragm, it basically fits inside the woman's vagina. It is used each time she has sexual intercourse to cover her cervix, the entrance to the uterus, and stops a man's sperm from getting through to join the egg. Diaphragm should always be used with spermicide. Yeah, now this spermicide is the stuff that kills off sperm. It's jelly type. Before you have sexual intercourse, you need to put the spermicide onto the diaphragm, then put it into the vagina so it covers your cervix. Now the advantages again, used only when you're having sexual intercourse. There's no hormones to it. Protects your cervix, so it can help prevent cancer of the cervix and some sexually transmittable infections. Does not affect your menstrual cycle, right, and makes sex less messy during periods. What are the disadvantages? Must be used every time you have sexual intercourse. Some women find the presence of the diaphragm in the vagina can be very irritable to the bladder, causing infection, and people could be allergic to the rubber or the latex of it. Condoms. So a lot of us are very familiar with these in terms of some of the learning that we've already had around it. Condom. What is it? It's obviously it's a barrier, yeah, which is rolled onto the man's penis before sex. It is used as a barrier to stop sperm and infection as well, passing between sexual partners, right? It is usually made of rubber. Where can you get condoms? So you can commonly buy them or you don't even have to buy them at family planning clinics, chemists. You do it at supermarkets, pubs, public toilets, variety of places. But it is cheaper to get them on prescription at family planning. Why use condoms? Well, why not? They help protect against pregnancy, STIs, including HIV, which can lead to AIDS. Your partner shares responsibility for safer sex and contraception. Most other methods of contraception protect you from. Sorry, most other protect you and protect yourself. Condoms as well. Condoms, they are easy to get rid of, and easy to use, and they have no side effects unless you're allergic to rubber again. The next one is the contraceptive implant. Basically, what are they? They're small rods, about the size of a matchstick, which are put under the skin under your arm. They slowly release a hormone called progesterone again, and implants between 3 to 5 years. How do they work? So the implants can stop the body from releasing an egg each month. They also thicken the mucus in the cervix, so that sperm cannot travel to meet the egg. It kills them off. How well does it work? Well, it's proven to be 99% effective again. Advantages and disadvantages. Well, the advantages are they're long acting, so once inserted, they're effective for several years again. They're easy to use, nothing to do and remember once they've been inserted, and apparently they're extremely effective as well. The disadvantages, again, you can have irregular bleeding and periods that last longer. It's quite common, especially in the first 6 months, and may last for a whole 5 years. It can be the reverse, so no bleeding, periods stop for women. This isn't too safe for your body. Insertion and removal needs to be done by a trained health practitioner. So there you have it for our first flipped class. Pretty heavy kind of topic to be doing for our first flipped class, but there you have it. Just hopefully you can get enough notes. I mean, there's plenty there in terms of your whisk sheet. But if you do have any questions that you might want to think about asking other people in class as well, I know a lot of you will be clued up on some of the contraceptive stuff that are around out in society. So you can use your question to question other people's knowledge, to see what they know. Or if you do have any other questions, make sure you jot them down. Alright, we'll see you in class. Make sure you have this whisk sheet ready for me on Thursday. Kia ora.